All right, perfect. So we're going to go ahead and get started. My name is Angela Christie Paul, and I am a doula. And so I'll go ahead and talk about what a doula does, and then I will pass it on to Val, who is over here to my right, who is a midwife, and over to Wynn after that, who is a pelvic floor specialist. And we don't have Shelby with us. She couldn't be with us tonight. So, so it's just going to be the three of us. So we won't have the lactation portion of our panel with us, but we'll just do what we can here. Um, so what is a doula? What I do is I support women before, during, and after their labors. I've been professionally trained, and what we do is help them physically, emotionally, and also with information. So if they have any questions, they can ask during that whole time period. Um, Things that we work on is a lot of times I will go to their homes. And initially, when I first meet them, kind of like just like to get a base of who they are, what they're looking for a birth. And I can support them with a home birth, with a birth at a birth center, or I can go with them to a hospital. So you're not limited where you can go. But things that I don't do with it would be like any kind of clinical type things like taking blood pressure or doing cervical checks, things like that. That's out of my scope. So I don't do anything like that. But a lot of times I will do a lot of suggestions for like position changes and just helping them, I guess, well, I'll find out like what it is that they're wanting for their birth, and then I am there to support that. A lot of times that means supporting the husband as well, as he supports his wife during labor. So a lot of times they'll say you need a doula for the mom who's giving birth and a doula for the partner who's there trying to help her. But yeah, so that's a lot of what I do. I also teach childbirth education classes, and I do prenatal massage. I'm also a licensed massage therapist. Um, but yeah, I'm trying to think what else. I don't know. Any questions? Out here. Some of the benefits. I did have a flyer, and if anybody is interested, they can go to my website, which is Angela Christie, ANGELA KRISTIE, and it talks a little bit about what a doula does and stuff like that. So there's more information on that website. But a lot of times we're there just to help them, like through the labor, suggest, like I said earlier, like different positions. I do a lot. I'm very hands-on. So especially being a massage therapist, I can do like a lot of counter pressure and massage. And, if you have chosen like to breathe certain ways, I can just help gently remind you of different things that you wanted to do during your birth, because a lot of times when you're actually in it, you just don't even remember anything that you wanted to do. So I remember I read like hundreds of books before my birth. And then when I was in it, I'm like, I have no idea what's going on. So it's just good to have somebody there who has been through it, and you're like, where are we? And also just to let you know, like, yes, this is normal. The stage that you're in, this is totally normal, because a lot of times you're like, I don't know if this is right or whatever. So it's just good to have that reassurance and everything like that too. So I don't know if I should go ahead. Are you ready to?
Sure.
Okay, so the difference is a lot between a doula and a midwife. A lot of people say, well, isn't it kind of the same thing? And it's really not. So this is Val Mahark. She is a midwife, and I will let her go ahead and talk about what she does.
Hi, I'm Val. I am a licensed midwife. I just opened a practice in Rogers City called Lineage Midwifery. And I also opened a birth center for my practice in downtown Rogers City. And the difference between midwives and doulas, like Angela said, she doesn't do anything clinical. That's my part. I do all the clinical care, um, like monitoring your vitals, monitoring your baby, ordering labs and ultrasounds, things like that. We still offer quite a bit of support for our clients like Angela would, but not as much. Doulas do probably a lot more work than we do. It's just different. Yeah.
Well, like last time you said you have to save your energy for like once the baby
We
comes,
really
you still
do.
have a lot of work to do.
Yeah,
So you have
yeah.
to be still on top of your game when the baby comes. So
Yeah, that's really true. The doulas do a lot of work throughout labor, physical work. The midwives are monitoring everything, making sure everybody's healthy and normal while they're using their bodies to do the counter pressure and the position changes and everything. So the midwifery team's a little more fresh and able to perform at the time of birth and in the immediate postpartum, which is kind of the most important part for us to be
Yeah.
alert and aware.
So it's definitely a symbiotic team. Like we have
Oh, for
some
sure.
together. It's not like,
Yeah.
oh, if I have a midwife, I don't need a doula, or if I have a doula,
Right.
I don't, maybe a home birth, or maybe you thought that a doula could deliver, which that would be outside of our scope of practice for sure.
Right.
We do not have the training for that.
Right.
So,
And we do work together
Mhm.
really well. I don't agree that people who have a midwife don't need a doula. I think everybody needs a doula.
I have a question.
Sure.
If you have a midwife and a doula, do you still have to go to the hospital and do all the testing, or can you do it at the midwife?
It depends what it is. Some things have to be done in a hospital, but we can do almost everything, like all the lab work that you would get done. I can do that actually at my birth center. I can draw labs. I don't have an ultrasound machine, but I can order one. So unless you need something extra that's not part of typical routine care, yep, we can just do everything.
Monitoring the heartbeat of the baby.
Yep. We don't have the big fetal monitor machine like they do in labor and delivery. We use a handheld fetal Doppler and we listen intermittently. So you're free to move around the whole time.
All right. Ready, Wynn?
I am. I'm Wynn. I am a physical therapist and I specialize in pelvic health. So I treat people the whole spectrum from trying to get pregnant to after pregnancy to a lot of years past pregnancy and delivery. So I treat anything from leaking pee when you cough, sneeze, or not making it to the bathroom, to bowel incontinence. A lot of women have pain with intercourse, and either that's making it really hard to get pregnant or that happens after birth, and we can work on that as well. I treat a lot of patients during their pregnancy. So if they're having pain, or any sort of discomfort during their pregnancy, I can treat that. And a lot of times we see the patient kind of right away when the pain is happening, and then we'll kind of keep the, mom coming in every 30 days or so during the pregnancy because things are constantly changing. So as things change and you need a little bit more help or support or different exercises, we can do that. And let's see, so incontinence, bowel issues, pain. Yeah, those are kind of, but and like I said, it can be anywhere along the spectrum. I mean, I see people in their 70s who, maybe the leaking started when they had their kids in their 20s and we can still address it. So it's never just because you're a little ways out, or a lot ways out doesn't mean we can't help. And that whole thing about like, you've had kids, so you're going to leak, or you've had kids, so you shouldn't jump on a trampoline anymore. Like that is a load of pucky. Don't listen to it. There's no reason that you still have to leak. There are definitely things we can do to make it better. And the issues that often kind of crop up after having a baby, often the problems So your pelvic floor does a lot of stuff for you, those muscles that support the baby while you're pregnant. And so they help with peeing and pooping, sex and babies, but they also help with your digestion, your circulation, your immune system, your breathing, the stabilization of your spine and pelvis. So if something goes wrong and those pelvic muscles don't kind of spring back like they should after you have your baby, we can see problems with any of those systems, but a lot of times we just blame it on like, oh, I'm carrying a baby around now, so that's why my back hurts, or, oh, I'm not eating right because, I'm too busy and that's why my digestion has changed or whatever. We tend to kind of blame it on other things. And our body just kind of compensates and finds other ways to do those functions. So a lot of times some of the symptoms don't show up till like around menopause. So when women are in their like 40s or 50s and just starting to get those hormone changes, all of a sudden they'll have leaking or those digestive problems will really crop up. So it's really important. I think every woman should have a check-in with a PT after their 6-week checkup with their doctor to make sure that those pelvic muscles and abdominal muscles and all that are coming back like they should.
I agree.
Yeah.
Mhm.
Yeah.
Yeah,
And in some
wholeheartedly.
places it is becoming more common and
Mhm.
hopefully more and more, but so to see me, you do need a prescription from a doctor, usually depends on your insurance, but most doctors are very happy. It doesn't have to be your OB. It can be your family doctor, nurse practitioner, a PA, whoever you normally see can send you. And they're usually really happy because physical therapy doesn't have a whole lot of side effects and things like that. So they're happy to help you in that way. So, and I'm always around for questions because it's not something people are really familiar with. So you can always call. I don't know if there's a way to leave her name. So I work at Thunder Bay Physical Therapy in Alpena. So our number is 989-358-8086. So if you have questions, you can definitely call.
Perfect. Yeah. So does anybody else have questions, or do you remember anything else that you wanted to like add? All right. I did think of one thing, as far as my child education classes. I do those in person, and I know that is at some hospitals or wherever that's not an option, but I do in-person classes. So. Yeah.
No, do you do group and individual, or?
Lately, I've been doing it like just with the individual couple. We get very personal and close and personal. So yeah, very open. But I could do group classes as well. So just depending on like how many people are interested at the time, but a lot of times it's just with the couple. So it's very, one-on-one personal. So that you can really know what to expect. And a lot of times we will deal with fears that you might have, because that plays into a lot of how your birth goes as well. So, yes.
Val, could you expound more on, I guess, your philosophy behind how you're helping the women in Michigan, what it might look like versus what it previously looked like? Like, what's the difference here between delivery care and some of the other options they have?
I think the main difference in the care is probably, well, the philosophy one and the time we put into it. We spend a lot of time with our clients doing education, answering all the questions, talking about the fears, working through previous births, things like that. We spend quite a bit of time with them. And my philosophy is that birth is a normal process. It usually, almost always, unfolds the way it's supposed to. It's not an illness. There's nothing wrong with you. You're pregnant and you're having a baby. And most of the time, if you leave it alone and let it go on its own, everything is fine.
We're made for this.
Right.
Built
It
to
just,
build.
it's a process that works. Now, does it always? No. There are times where you need help. And you need a higher level of care than what I can provide. So in those instances, I'm glad that the hospital's there. Some people can't have their baby at home. Some people don't need to get their care from me. They need to get their care from an obstetrician. And I'm really glad they're there for those people. Yeah.
Mhm.
And you guys service all of Northeast Michigan, or where's your service area?
Right now, mine is pretty large, I guess. Presque County, Alpena, Montmorency, Sheboygan, for home birth. And anybody who's farther than that is welcome to have their baby at the birth center.
Mhm.
Or anybody, even, you know, if you don't want to have your baby at home and you're close by, just come to the birth center too.
Right.
That's fine.
Right.
Yeah.
Yep. Yeah, and so I have gone with families to Petoskey, to Alpena. I will go down to Gaylord, kind of like that. Like as far as like in hospitals, I will venture out that far. And then home birth, probably a similar radius.
Yeah.
Hmm.
I'm pretty okay with Petoskey too. That's in Emmett County, but
Starts getting a little farther.
yeah, it's easy to get to.
Yeah. Yep.
Are you guys gonna be doing more classes like this, you think, or are branching out to do some informational stuff at different places?
Yeah, we're
Maybe.
possibly going to have another one at the same location here at the Alpena Library in the fall. And then depending how summer goes, we may also venture over towards Sheboygan area and Gaylord as well. So that's kind of like our future plans. So
And babies can come?
definitely,
yeah.
definitely,
Whole
we're very
families.
family friendly.
Yeah, that's
so-
what we do. We take care of families.
Exactly. And I even made lactation cookies. So like everyone can come and try them out. Yeah. So anybody else have any questions? Yes.
So the question was, natural birth after C-section.
That's actually something I feel really strongly about. I get a lot of questions about it. Every organizational, whatever you want to call it, body, even the American College of Obstetrics and Gynecologists say that VBAC is safe. Whether or not individual facilities want to include that in their protocols is different. That's up to them. Myself as a provider, I do attend VBACs. My only hard and fast rule is that they have to have had a low transverse incision in their C-section. And anything more than 2 C-sections, I'd rather them be at the hospital instead of at home. Ideally, they'll have a space of 18 months between births. Some people will give a good informed refusal to seeing an obstetrician for a smaller space than that. But I feel really passionately about helping VBAC clients and reducing the primary cesarean rate. That is actually the main issue. It's quite high. And if we're not going to be supportive of VBACs, we really need to get that down.
Well, I know I appear to be just like a construction manager.
It's
I've
okay.
studied biochemistry and medical for 6 years. My grandma was attacked by many other things. Afterwards, I hope to die.
Oh.
Took it to a whole new level. It's like all the things I'm not supposed to say. Lying, you know,
Yeah,
Yes.
absolutely. Mhm.
Who knows? We don't even know.
Right, we don't know. There's
Yes.
a lot we don't know.
I've got a niece who's just as good as you think, and she stayed home and gave a natural birth after C-section. Woman I'm with, I've been with for 14 years and raised her son, she was pregnant when we got with her. We've been together 14 years and we're about to have our first.
Ah.
Hopefully I'll still be here.
Yeah.
Yeah,
Exciting.
very natural. Like, everything.
Mhm.
Oh.
We try to avoid that hospital.
Yeah.
All the way around. You guys like, this is all safe. Next thing starting is
Yeah, and we just wanted to inform people about the options that
Yeah.
are up here, so that people don't think, well, I have to do this. This is the only thing that there is. It's not like there are many options, and if somebody does find themselves like needing to go to the hospital and they still have that kind of fear factor, it's nice to have a doula who supports your vision of birth, like what you want.
Everybody needs their own. What is that, their own?
I think that should be your choice.
Definitely.
I mean, that's the bottom line. No, I actually don't even, it's not even in my scope to give vaccines. I
Yeah.
can give you the information about it, but I can't even do it anyway. The only time we give a baby an injection is a vitamin K shot. That is optional. Or the metabolic screen where they poke the baby's heel and take the blood to test for metabolic disorders. But those are all options. You're not required to do any of that.
Right.
That won't have the baby with my side.
Right. They're pretty good about letting the baby stay with you.
Yeah.
Yeah, that's something that's good. Mm-mm, no,
And
No.
I think if there's like they need to do something with the baby, you know, if the mom stays in the room, usually her partner can go
Mhm.
with the baby.
Yep.
That's been my experience, but
You know, when you get in that hospital, they get really authoritarian.
yeah. Yeah,
Good.
absolutely. We're happy to be in the area serving people.
Yeah.
Yeah.
That's part of why I wanted to do this was because I get so many pregnant patients in and they don't even know what a doula is. They
Right,
didn't even know
right.
that's an option, you know, so
Right.
it was a good idea.
Yeah, exactly. And, you know, some of the misunderstanding about thinking that I deliver the babies, they don't know that the doula can go with them to the hospital,
Right.
you know,
Or
so.
that doulas are only for natural birth.
Right,
that's
that's
not
not the
true
case either.
either.
We can,
Yeah, a lot of, I think everybody needs a doula, like
yeah.
even C-section. C-sections are stressful. You need that support.
Yeah.
Yeah, it's harder than natural birth, I think.
yeah. And especially
Don't
because
get
it
mad at me for
leaves
saying
like
that.
the baby can go with or the dad can go with the baby, well, the mom can still, or a doula can still stay with the mom so that
Mhm.
she still has support and doesn't
Right.
feel alone, you know, so that's
Yeah.
very good. It's just, yeah, all around
Mhm.
good support to have.
Good question about how do you set up a home birth?
Oh, that's a good question.
Yeah.
So we prep ahead of time. They purchase a birth kit with things that I need in it, like sterile gloves, a placenta bowl, things like that. And then they have supplies that they probably already have at home, like sheets, towels, a crock pot, washcloths, things like that. And then they have that all ready. We do a home visit for them at about 36 weeks. So we go and make sure that they have other stuff. And we talk about which space they think they want to use. I have birth pools that I loan people, so we find a good spot to put that and make sure that the water source can reach it. And then when I get called to the labor, I bring all my bags of equipment in, like my Doppler, my stuff for vitals, oxygen tanks, medications. I haul all that around with me. And it really isn't hard to set up. We just need like somewhat of a flat space to like lay a tray out on with our resuscitation equipment if the baby needs help breathing. And then we just kind of, it doesn't take up a lot of space.
Yeah.
It's kind of a lot that we carry around, but it's easy to set up and it's easy to clean up. There's really not that much mess.
And so also for Val, when you're doing a home birth or even a birth at the birth center, you typically have an assistant with you.
Oh, yes, always.
So,
Always at least a team of 2, a team of 3 is ideal. I don't want to be at a birth by myself. I need a doula
support.
too.
Doula for some advice.
Yeah. Did you have a question? My whole package for the home birth, everything, including all your prenatal care throughout pregnancy, the birth, immediate postpartum care, 6 weeks of continued postpartum care and newborn care is $4,000.
That's a good deal.
It's a lot.
It's like
yeah.
less
It's
best.
not expensive.
Like she's already bought once a month.
Mhm.
I don't know what that means. You should have already been in the picture.
I don't mind taking people later. Like people switch providers all the time.
I get the best. All the prenatal plans.
Mhm.
They're all liable.
Right. Well, when I say prenatal, I mean all your prenatal care, like all your appointments. I do the same appointment schedule as like an obstetrician would. I see them every month until closer to the end, and then it's every 2 weeks and every week.
And
So,
what do you cover in your prenatal appointments?
oh, we talk about everything.
Are you
We
checking
do,
the size and
we're
palpating?
checking the size of the baby's heart rate, mom's vital signs. We talk about nutrition every time. We talk about testing, like some people want to do all the tests throughout pregnancy, and I can still do those, so I counsel on that. Birth preparation. We constantly review risks, like especially people who have things like a VBAC or controlled gestational diabetes. It just kind of, it's very individualized. What's going on with each person is what we talk about. And come up with the best plan for each person.
She did have a low tide. She got really- I know she-
Yeah, I think she can too.
Absolutely.
We're moms, we don't know what it is. We're not in a rush to get a doctor. We're- She wants a picture. So, like, well, wait, this long. I want that last. It's just.
Mhm. Right. Mhm.
Anyway, it should be okay now. We have that. You do that stuff.
I don't right now. I'm working on getting a bedside ultrasound, but that might be a little down the road. I can order one and send people wherever. Mhm. Cool. Here we
Very
are.
good. Yeah.
Since you talked a little bit about the biome, can you tell us, and since we're on the cesarean topic,
Mhm.
what can you do for a mother who did have a cesarean but still wants those vaginal biomes in the baby?
Right. So there is a thing called seeding where you can swab the vaginal canal and put it in the baby's mouth. I don't know a lot about that at all. I've never done it. I've never recommended it. Because we have a really low C-section rate with our clients, so like it just doesn't come up that often. But I do know that you still get some of the microbiome from breast milk and just from being in this area, you know, on the mom, from the armpits, the breasts.
Whatever comes out. Doesn't there a bunch of juices and stuff that come out?
So there is the placenta and all the fluid and everything does come out. I don't know a lot about the microbiome of the placenta itself because when it's the baby's inside the amniotic sac, it's kind of sterile. There's not a lot of bacteria in there. Right, it picks up on the way out.
I've heard of some procedures out there.
Yeah.
I don't know. I just don't know a lot about it. It hasn't come up. Yeah, and it's just not, I don't think that's very common. You know, it's probably not offered in a lot of places.
And probably not suggested either, you know, if they're not so
Right.
familiar with it, you know, doctors
Exactly.
either.
I mean,
So,
it kind of makes sense, you know, if you think about it, if you're just moving it from one place to the other.
Mhm.
I don't really have an opinion on it. I think if somebody wanted to do it, I would just say, yeah, go for it. I mean, it's not,
the mother could
it's your
potentially
baby.
just do it herself, you
Right.
know.
I mean, yeah, it would be
So-
pretty easy to just do it yourself. It was just a swab. So
Right.
I guess I don't feel one way or the other about that.
Mhm.
Right. I mean, you know, finger.
Right.
Right.
Yeah. All right. Well, thank you everyone for showing up and
Thank you.
asking the wonderful questions. That was really good. And
Yeah.
I think we covered a lot of topics and stuff. So hopefully we will see you again at the next one. We will keep you posted. Thanks.
Thank you.
Mhm.
Yes, we are. She's
Yep,
here.
I'm
in
She's here.
Alpena.
I'm Alpena.
All the time.